Hey, my name is Dr. Sean Price, Clinical Coordinator here at Cairo Spa in Fort Walton Beach. And this is video number 2 in our digestive health series. A lot of times patients come in and they have chronic conditions such as hypothyroidism, diabetes, Crohn's disease, irritable bowel syndrome, chronic fatigue, fibromyalgia, all of these different chronic conditions. But it's very common to have some kind of a digestive issue or digestive function problem going on. So what I'm doing is putting together a series of videos to help you understand more about your digestive tract and more about what's going on. Today I want to talk about probiotics. Probiotics are very, very common, very commonly used. And not all probiotics are created the same. That's a subject of another video, but I want to just talk about the need for it. Now basically what happens is when we're born, our digestive tract is completely aseptic. It's sterile. There are no bacteria or anything going on in our systems. Our first exposure to bacteria is when being birthed through the vaginal canal. So if a child has a cesarean section and is born through C-section, they don't get that exposure to the good bacteria. And that's strike one against you having a nice normal gut flora. Then when we go through breastfeeding, we're exposed to these different good bacteria through the breast milk. So if a child is not breastfed, then that's strike number 2. So you can start having this dysbiosis or this abnormal gut flora from a very, very young age, and then it just proliferates from that point on. So one of the things to consider is, do you need a probiotic? Two of the most common bacteria that are in the probiotics are going to be lactobacillus and bifidobacter. And these two, are very, very common. These are what are considered to be our good probiotics. But the problem with it is, if you take it and you don't need it, you can actually increase that colonization and throw the system out of balance, because everything in the gut is based on balance. And when the gut goes out of balance, whether it's through antibiotic use, through eating too much sugar, through other poor dietary habits, lack of fiber, things along those lines, that's when the digestive system gets out of balance, and that's when you start having issues. So you can do the same thing. If you start taking too much of a good thing, it can throw the system out of balance. So you have to determine what type of probiotic do you need, what are you deficient in. You have to determine how long do you need it and how much do you need. And the best way to determine these factors is through stool sampling. You do stool sampling and it'll tell us what bacteria are out of balance, which are too high, which are too low, and what can be done to try to get in there and resolve the situation. So I hope this makes sense. Again, just a shotgun approach to probiotics, just like pretty much anything in your health, is not the best idea, because you can actually throw yourself out of balance. And so keep that in mind. If you have any questions, feel free to post below or contact us at the office. Have a great day.